Well, I'll start over. My name is Jake Carpenter, and I am from Juneau, and I am on the Health Tide Board of Champions, but I'm also a software developer, and I have been working with Lizette and Kim to develop an app called DSP Hire. And basically, the point of this presentation is to tell you a little bit about that app. You may have already seen this presentation. I've done various versions of it a couple times before, talking about where we're at. So if you have, please bear with me. Don't worry, it's a fairly quick presentation, at least in terms of me. DSP Hire was created to tackle the workforce problem. The workforce problem exists in a lot of industries, but in the terms of developmental disability organizations or agencies, the workforce problem is specifically finding people to fill the position of a DSP, which is a direct support professional, to serve those in our community who need a little extra support throughout their day. Before we get to that, though, I'd like to talk a little bit about myself and why I'm here. I grew up in Alaska, and I went to the University of Alaska in Juneau. I went to work in the nonprofit world, and I didn't get right into tech necessarily, but quickly found myself there and became proficient in technology. I actually have a degree in communications, which isn't necessarily a technical degree. From there, I went to work for the legislature and learned how to program, and I created the software that runs alaskalegislature.tv and Gavel to Gavel, which a lot of people are familiar with, which really sparked my interest in creating technology for people that made their lives easier, and that really gave me sort of the direction that I was taking for everything that followed. After I left the legislature, I moved to the Bay Area, Silicon Valley specifically, and I worked for startups in cryptocurrency and television, and then retail. It sounds boring, but there were really hard problems to solve, and I got very attracted to hard problems. I came back to Alaska and found myself looking for the next challenge. Now, I like to tell a little story here because I feel like context is important in any story. I am a technologist and an entrepreneur on one side of my life, and on the other side of my life, I'm the brother of somebody who experiences pretty severe disabilities and has most of my life. And I try to keep my life pretty well compartmentalized, so it's funny that I ended up creating an app to support DSPs when DSPs were ever present in my life growing up. I didn't have a holiday or a vacation or even a normal day until I was 20 that didn't have a DSP at my breakfast table. So if you haven't had use the supports of the services of a DSP at some point in your life, you probably will. DSPs support the disabled, the young, the elderly, and those who otherwise can't take care of themselves. The reason that I ended up here was I learned about this thing called a wicked problem. And a wicked problem is a social or cultural problem that is difficult or impossible to solve for as many as 4 reasons, often more. You can read them here, but basically, the problem is so large and so interconnected, and there are so many viewpoints that it seems impossible to solve. But they're not impossible to solve, and you can solve a wicked problem the same way you solve any other problem, one bite at a time. DSPs in the state of Alaska have a 12% overall vacancy rate. In the United States, 38% of DSPs left their position in fewer than 12 months. There was a 46% average annual turnover rate nationally. And in 2025, there will be more than 1 million full-time DSPs. So it's a big problem and a lot of jobs out there that need to be filled. The math is pretty simple. On a 46% turnover rate on 1 million positions, that's 460,000 jobs at least, that need to be filled every year. If you look at other industries, there are very few industries that have this level of turnover, as well as this number of people leaving in the first year. And there's a lot of reasons that people leave. They leave for low starting wages. It's really hard work. It's a complicated regulatory environment once you're in a position. Because it's a medical field, there are documentation requirements, ongoing training requirements, and compliance issues that need to be tackled on a daily basis. There's also a lot of hoops to jump through just to get the position. Some of the best potential DSPs out there may not even get past the hiring procedure because there's a lot of T's to cross and I's to dot just to get the job. So when eating an elephant, one bite at a time is how we start, and we chose lots of hoops to jump through as our entree into the problem-solving process. DSP Hire was created to tackle the hiring process for DSPs to get into the workforce smoothly, efficiently, and with as little fuss as possible. Our goals are to simplify the hiring process, automate the busy work. There's a lot of stuff that, despite the job being relatively similar across organizations, the paperwork and process to getting hired can be very different. By streamlining some of that and automating the rest of it, we can hopefully someday make getting a job as a DSP as simple as clicking a button in an app. The development process was a lot of fun for this project. I worked with Kim to sketch out and talk about what we wanted in an app, and Lizette as well. We talked about what we thought was necessary and what the critical components are. And then I sat down with a pen and paper and actually sketched out what the app would look like. I have a screenshot here of some pretty rudimentary hand drawings I did after our first meeting. There's several pages of these. Then we send those out to a designer, and they come up with a first blush design, which is what we're at now. This is the actual home screen for the app. As you can see, it is very simple. You can track your applications, and you can search for jobs. For this job, or for this screenshot here, you can see that my application with Hope Community Resources is at 60%. Those milestones, if we were to click into it, would show you what each milestone meant. We can also continue to search for new jobs. When looking for a job as a DSP, while jobs may be similar, there's some key differences to each one of them. The app itself, and I'm going to try to go through this app stuff quickly because I know that's probably not the most interesting to a lot of people here. Each position has various components, so we've decided to simplify and identify the various aspects of each job with icons. So for example, if this moon is lit up, that means it's an overnight job. This one means that there's a car required. This one means that you might have to do some shopping for your client. This one here is a little clock. It's hard to see, but that means it's a part-time job. We have a whole slate of icons that you can use to see at a glance what a job would entail. Once you find the job that you like, you can click on it, you can apply, and all your information which is saved is transmitted to the organization, as well as some organizations require an email or you to submit a copy of your ID or your background check or your first aid certificate. That is all sent over when you click apply. One of the exciting things about using an app and getting it in people's hands is that there are a lot of additional things that we can do to either make the process better for the employer or the potential hire. One of the items that we're working on is an intro to DSP video. Basically, if somebody downloads the app, the first thing they can do is watch a video to see what the job is actually like, to see if it's something that they want to do, and show them what they can expect by doing the position. They can also chat with an existing DSP. As the DSP community is very large, there's quite a few DSPs in Alaska, it's an opportunity to connect with somebody who's already doing the job and see what the position might entail. Additionally, down the road, there are opportunities for post-employment features, things like scheduling or timekeeping or notes verification or location tracking, things that can be tedious for organizations and employees now, we can build into an app, because one thing people always have with them is their phone. On the agency side of it, you can't manage what you don't measure, and we have a dashboard that allows us to manage and understand how people are interacting with the app. You can see if they're viewing your jobs, if they're applying to your positions, and what that process is like for people, and you can optimize on the fly. So where are we at this project? We started in June with the brainstorming, and we moved into developing the prototype, and that's sort of the drawings that you saw. We're currently in the closed beta, which means that we're testing it ourselves, and we're gearing up for a pilot project. The pilot project will proceed to launch once we've figured out, what is the most important feature that we need to launch with. We'll actually have a launch and release it to anybody who wants to use the app. The pilot project right now is going to be run through HealthTie. If you're not familiar with HealthTie, HealthTie is a project that a lot of people here are working on, which is a test bed for innovating in the healthcare world. These organizations, and actually several more since we've made this slide, have agreed to participate in a potential pilot project. They haven't received the exact details of what that project is, because frankly we're still working on them, but we're excited that so many organizations have reached out and expressed interest in HealthTie and DSP Hire. The pilot project and where HealthTie fits into this all is HealthTie is really the nexus for this project. We're hearing somebody. If it's possible, if you can mute your phone, that would be helpful. So what we're going to do is we're going to release an app to users, and once the users have that app, they're going to use it. Where HealthTie fits in is the HealthTie project team will actively connect me, the developer, and the designers that I'm working with, to the users, and take the feedback that we get and turn it into actionable items that we can take and turn into features in the app or changes to the interface. Once they collect that feedback, they'll provide it to us. We will do what we need to absorb that feedback, and we'll release a new app. And we'll do this cycle until we feel like there is an app that provides what everybody needs. There are three key groups here, and I'm sorry, I'll try to hurry up because I realize we're running low on time.
Jake, let's go, because we lost a bit of time in the beginning. Let's not worry too much.
Okay. Our users in this case are the potential DSPs and DD agencies and companies. These are the people that are going to be listing jobs and applying for jobs. We're going to be asking those participating in our pilot program to be a little more interactive with us, and they're not just using an app like they'd find on the App Store, but they're actually going to be participating in developing the app. So we're going to regularly survey them, track their usage, and create a pipeline of feedback so that we can be sure that we're capturing every problem or every potential opportunity. HealthTie has the job of interfacing with everybody, of sort of being the relationship manager here and keeping the flow of information going between DSP Hire, the users, and HealthTie. And also standardizing the information. It's hard to iterate on a product or to make things better when we're not all on the same page, and that's the key role that HealthTie is going to be filling here. And then my role is to meet with HealthTie and our users, to take that feedback and actually turn it into real changes in the software and the processes therein. Oops, did I miss one? So how can you get involved? Well, if you'd like to be involved in the pilot project or HealthTie, you can reach out to the HealthTie organization by visiting healthtie.org. You can also go to dspHire.com/info. I've got a form there that you can fill out with your contact information, and we're setting up a mailing list to actually talk about the DSP Hire product, when we're going to launch, for users, for organizations, and we're also going to have some events much like this, but they'll be more technical, where we sit down and talk about the product for those people who are potentially going to use it. And you'll find out about those through our mailing list. And with that, I'd like to open it up for questions, if you have any. Otherwise, please visit our website and fill out that info form. Really, that's all that's at that website right now, is that info form. So there's not a lot more information there, but we'd be glad to send you some if you reach out.
All right, well, let's take a minute and open it up for any questions. We got some chat saying that this was going to be very useful, but is there anybody online who would like to ask a question?
Hi, this is Faith Kelly with the Center for Human Development in Anchorage. I just wondered if I think this is really cool. I just gotta say, I've been hearing about it, and I'm really glad to see the organizations that have already signed on to be part of your pilot. I just wondered, are there other industries that have used or developed apps similar to this, or are you exploring other applications of it? For example, in the straight up medical field, for nurse and physician positions?
Yeah, so that's a really great question, and we absolutely have. And actually, since we've been talking about it, we've had several industries reach out to us and ask us to apply it to their industry. You know, one of the reasons that we're focusing on DSPs, well, there's a couple reasons we're focusing on DSPs. One is that the Alaska Association on Developmental Disabilities reached out to us to develop this, and it's actually through a grant from them through the Mental Health Trust Authority that we're developing this app. So that's where our focus is right now. Additionally, while DSPs are a pretty regulated position, they're not as regulated as professions like CNAs, RNs, doctors, things like that, that would actually require professional licensure. It's something that we're getting towards, we're looking towards doing, but certainly that's a little ways away. As far as outside the medical industry, there are examples of apps very much like this for various professions. You know, I think there are apps for agricultural workers. In certain areas, some unions have apps for union positions. Nothing that is universal across multiple companies, which, to be honest, is one of the challenges that we face, right? There could be, you know, there can be participants in the DSP Hire app that may have competing interests, and that is one of the reasons that we're running a pilot project, to figure out how that all pans out. I hope that answers your question. I see that we have a couple questions online. Do we have any feel for the cost to users? We have a couple ideas for pricing models at the moment. During the pilot project, if there are any costs, they'll be very limited, probably just to cover expenses, and I don't think that really there will be any, at least for the beginning. Once we launch as a product, the cost for people applying for jobs, there probably won't be any. It makes sense to have the platform be open on that side. On the agency side, we've looked at a few different pricing models. There are staffing services that can charge, up to 10% of an annual salary. We're hoping that that's not the model that we use. I think that isn't workable in this industry. Do we have plans for a person seeking support to be able to connect and recruit their own DSP, person-directed hiring? We've actually gotten that question quite a bit, and it is our hope that we can go there. Speaking from my own experience, for my brother, we go through an agency for most of his staff, but we actually do recruit our own staff for certain things, and it can be a real hassle and a lot of work, especially since we're not an organization, to handle some of that stuff. So it's certainly on our roadmap.
Let's have one more question. Is there one more question somebody would like to ask?
I had a quick follow-up from okay, it's two of us. Never mind, I'll back down.
Oh, this is Lizette. So I just would like to say thank you, Jake, for all the hard work, and I really want to thank you for recognizing that the Mental Health Trust is funding much of this development, and we just feel really fortunate to have that funding source and to have found Jake moving this forward. And I really like the PowerPoint today. Thanks.
Thank you, Lizette. Nigel, the real Nigel, would you like to say something?
Sure. No, I wanted to also thank Jake. I mean, I think this is a great example of what HealthTie was about. We promoted a problem. We found a developer in the community. And I think Alaska is very lucky to have you working on this right now. I'm interested in obviously thinking of it more in a startup context. I went through Techstars with a child minding, app where people wanted to find childcare providers, for themselves, like at a click. So kind of a Uber for childcare, I guess. And it seems like you could have an Uber for DSP hire to some extent. Oh, sorry, Uber for finding DSP to some extent. What to do as far as, once people start using this, these platforms have a way of morphing into, the users wanting something different and else. How do you deal with those that are going to come about? And, what is the sort of underarching aim? Because you may end up moving away from actually solving the current problem and need to something, maybe more centered around like hire or whatever it might be. So.
Yeah, again, Nigel, that's a very good question, and as you may tell, I'm keeping the focus here specifically narrow, which is hard for me. There are a lot of questions to be asked and answered about that. I think in order to be a sustainable product, we inevitably will need to move beyond this niche. But I think right now the focus is just on this problem, and where we go from here still, I think, remains to be seen.
Well, I want to kind of break in here and say thank you to Jake. It truly is exciting. Thank you for this presentation, and we'll be following you. I think it's a good role model for what HealthTie can do in the future for other problems. So I think to just follow up with what Nigel said, I think this is just the tip of the iceberg, and I think that we'll find other similar problems, and this will be a good test, actually, for how we can move forward. So I'd like to thank each of you who participated today, and if you have any follow-up questions, please send them either to me or to Jake, and we'll ask Jake actually to come back maybe in about 6 months and give us an update, because he'll, thanks to his prototype and other things, he'll have some new information. So, well, that's it today for HealthTie, and I'd like you to tune back in 2 weeks. We actually have T-Care going to present at that time. So same time, same place, and we'll see you in 2 weeks. All right, take care. Bye.
Thank you.
Thank you.
Thank you.